Hello and welcome to another installment of our Whiteboard Wednesday. Today I am joined with Dr. Kurt Loveless. I'm Dallin Ricks, and we're going to be visiting today about the reasons it's important to replace missing teeth.
I hear people come in all the time and they're talking about, well, just pull a tooth, just take it out. You know, do I really need this tooth? And you know what, we'd like to address the issues that develop with tooth loss, because there are quite a few. Number one, you have to understand that the mouth is a very dynamic organ. The teeth are in the positions they're in because of the forces that are placed on them by the lips and the tongue, and how the bone architecture is you know, the teeth are into the bone. So when teeth are removed, that architecture and that equilibrium is affected by the missing tooth. So teeth begin to move. They can move in a lot of different directions. They can move in a lot of different ways. Orthodontic treatment is all about this concept, placing brackets on teeth and using arch wires to get the teeth to line up on the arch wires, use the exact same dynamics of tooth movement that happens whenever there's not a tooth there to hold it.
So when a tooth is lost, the first thing that can happen is the bone around where that tooth used to be starts to go away and is lost. As that bone goes away, the teeth, like Dr. Lovell said, actually can move into that space or collapse into that space. What happens then is that the tooth above it or beside it also shift and can cause breakage or chipping of other teeth, and future tooth losses is very common when we see one tooth loss. Other things that we see is that the balance of the bite, like Dr. Loveless said, changes and is affected. And so teeth that normally don't hit very heavy now hit extremely heavy and can cause problems.
One thing that we see is there's almost a domino effect to tooth loss in the mouth. You lose one tooth, it concentrates more force on the teeth around them. So if you have 4 teeth in a quadrant that are taking all the force of your bite, and then all of a sudden you have 3, well, now you're dividing that force 3 ways instead of 4 ways. So frequently what we will see is either a breakage of the tooth in the adjacent space, or even splitting of the tooth, and a split you can't fix, and so you end up losing it again. So I see this domino effect where you lose one tooth, then you lose another, then you lose another, and eventually then you're into making decisions about, okay, should we remove them all and make a set of dentures, or, you know, even more costly is to place numerous implants and do some sort of a prosthesis on top of the implants. And so you're making decisions to remove one tooth because it's a short-term quick fix, but in the long term you're just digging yourself deeper in the hole of what you're going to have, because I promise what I make you're not going to like as well as what you had to begin with.
Another thing that we have patients consider is where the tooth is in the mouth. You know, with an anterior or a front tooth loss, that's considered is a aesthetic consideration, but also in the back, that is a support issue. And as we lose back teeth, we're putting more and more force on front teeth, and they were never designed or are big enough to handle the force of the bite. So like Dr. Loveless says, as the back teeth go, we then have front teeth that start to fail because they're being stressed in ways that they never were designed to do so.
Back to when we started this video, we were talking about, I get asked all the time, do I really need this tooth, or is this tooth important? And you figure you have 32 teeth, so is one tooth important? I want to tell you, as a matter of my philosophy, I'm always going to tell you every one of your teeth are important. Even your wisdom teeth can become very important. And so any decisions that are made about whether you remove a tooth or whether you try to keep a tooth are all based on what the conditions are, what the prognosis of the tooth is, and what the consequence of that is going to be down the road. I just want you to understand that we're going to take any decisions like this very, very seriously.
And if you ever have any questions, go ahead and you can come in and see us, or you can comment on this video. We'd love to have that conversation with you. Our teeth are important. We want to help you save as many as possible for as long as possible. Now, next month we're going to be doing a segment on the jaw and the joint of the mouth, and so we hope to see you then. Be sure to like or comment or share this video. That'd be great. We appreciate it, and have a good day.